year, especially the last few months, you may have noticed a lot of news of pneumonia, especially in the toddler age group, in the young elementary age group. There's been a lot of pneumonia going around, lots of walking pneumonia, lots of pneumonias that need to be hospitalized, lots of pneumonias that need 2 antibiotics at the same time. This is completely unheard of in pediatrics. And one of the main reasons could be COVID, of course. So how does that make sense? Well, generally in the respiratory system, in the nose, down the trachea, into the lungs, we have cilia. Cilia are like little finger-like projections. They're very tiny, and they're supposed to catch all the mucus, all the dust, and they move in an upward direction. The cilia moves all that dust, all the allergens, all the pollen, all the viruses, all the bacteria in an upward fashion so that you can either cough it out, sneeze it out, blow your nose out. That's how cilia works. Now what COVID does is COVID actually inhibits the cilia. It restricts their growth. It causes damage to the cilia. And so now there's no natural way for the body to cleanse itself, and more viruses get into the body and they cause problems. In kids, their cilia doesn't completely mature until after the age of 8. By 8, they have more of an adult respiratory system. So before the age of 8, they are prone to having more infections. That's why younger kids have lots more colds anyway. That's one of the reasons. But when your cilia don't function properly, if you've had a mild COVID infection, or you may have had COVID and not really known you've had COVID, and kids have runny noses all the time, so who knows what they have. But the damaged cilia, it can take 6 weeks, several months for the cilia to come back to normal. So during that time frame, when you get other viruses in, you're going to have a pneumonia. And so that's why the pneumonias might be a lot higher this year, is because of previous COVID infections, subsequent COVID infections causing lots of cilia damage. So that is one theory that is out there. So keep that in mind. That could be one reason why we're having a lot of pneumonias this year.